Hello and welcome to Wheel of Wounds. I am very honored and pleased to introduce our co-host, celebrity co-host, Dr. Barbara Bates-Jensen. Hello, BBJ.
Hi, it's a pleasure to be here. Thank you for having me.
Are you ready to spin for us tonight?
I am.
Fab. No, BBJ. No,
Oh,
You're
sorry.
going to be spinning the wheel.
Ah, okay. Yeah, I'm ready to spin that too.
Fabulous. Well, listen, we are very pleased to have you here. I know most of our audience knows who you are, but in case there's a few out there that don't recognize the name Dr. Barbara Bates-Jensen, why don't you just, for our audience, please just give a little bit of a brief introduction.
Sure. I'm an associate professor at the University of California, Los Angeles in the School of Nursing and the School of Medicine Division of Geriatrics.
Okay.
My entire career has been focused on pressure ulcers, and all of my research is targeted specifically at populations at risk, spinal cord injured veterans and frail elder nursing home residents. I'm also the co-editor of the book Wound Care Collaborative Practice Manual for Healthcare Professionals.
That should be on everybody's library shelf.
Yes, it should. Yes, it should. And I'm also a past National Pressure Ulcer Advisory Panel board member, and pressure ulcers are kind of my life.
Well, we appreciate you bringing that expertise in wound care in general, but specifically in pressure ulcers to our show tonight. We're very happy to have you here, and we're very excited to have you spin. Now, as tradition has it, we typically spin for a member of the audience. Many select one of the wound types, and we at random pick out an envelope. And tonight I would like to have you open this envelope and tell us who the winner tonight is, or actually who the contestant is.
It's almost like an award show, but kind of different. Let's see. It goes to Walter Chua at Long Beach, VA. And I know Dr. Chua. He's great. He works with pressure ulcers.
He picked pressure ulcer. Dr. Chua, congratulations. We'll see if you are a winner tonight. Dr. Barbara Bates-Jensen, BBJ is going to spin for you. Congratulations, Dr. Chua, participating as a contestant. So take it away, spin.
Thank you.
And around we go. We don't know which wound it's going to land on.
Boy, it goes a long time.
You have a lot of strength in those arms. My goodness, we have to decide which wound we're going to land on here. Pressure ulcer.
That's excellent. Now let's listen to Sharon Baronowski tell us a little bit more about pressure ulcers.
Congratulations, Dr. Chua. You are a winner and will be rewarded a free participation and membership at Wound Care Boot Camp. Please contact WebCME for your free holiday gift. And Sharon, if you're ready, please take it away. Pressure ulcers.
Our wheel of wound selection today is pressure ulcers. Pressure ulcers are areas of soft tissue breakdown that result from sustained mechanical loading of the skin and underlying tissue. This can and does affect the quality of life of many of our individuals. Pressure ulcers are defined by the National Pressure Ulcer Advisory Panel and the European Pressure Ulcer Advisory Panel as a localized injury to the skin and/or underlying tissue, usually over a bony prominence as a result of pressure or pressure in combination with shear. A number of contributing or confounding factors are also associated with pressure ulcers. The significance of such factors is yet to be understood. This can at least be partly attributed to scientific knowledge of the etiology of the clinical condition and the fact that identification and prevention of pressure ulcers mainly focus on soft tissue, even though underlying muscle tissue may be more susceptible to mechanical loading. Traditionally, the etiology or primary contributing factors of pressure ulcer development have been listed as sustained pressure, shear, friction, and moisture. Let's talk about this concept for a few minutes and look deeper into what that really means. What is pressure? Pressure is the perpendicular force in excess of capillary flow to the tissue. Ischemia, as a result of sustained pressure, will cause deformation of soft tissues, which can lead to hypoxia, the blocking of nutrient supply, and the removal of waste products. Deprivation of nutrients and removal of waste products will eventually lead to tissue damage. When your skin and the underlying tissue are trapped between a bone and a hard surface, such as a bed or a wheelchair, the pressure may be greater than the pressure of the blood flowing in the capillaries that deliver oxygen and other nutrients to tissues. Pressure damage or pressure ulcers result. Let's talk about shear. Shear occurs when two surfaces move in the opposite direction. For example, when the head of the bed is elevated, a person can slide down in bed. As the tailbone moves down and the skin over the bone may stay in place, eventually pulling in the opposite direction. This motion may damage tissue and blood vessels, making the site more vulnerable to damage from sustained pressure, with resultant hypoxia and tissue damage. Friction is the resistance to motion in a parallel direction relative to the common boundaries of two surfaces. For example, when a patient is pulled up in bed, friction may occur when the skin is dragged across the surface. This movement has an abrasive action and can cause damage to the epidermis and the dermis, thereby setting the stage for infection to occur concurrently with a pressure ulcer. This friction force or resistance to motion may be even greater if the skin is moist from incontinence or medication. Moisture in and of itself does not cause a pressure ulcer. However, moist skin does not tolerate sustained pressure and can easily be insulted by friction and shear forces. Moisture can occur from many sources: perspiration, incontinence, wound drainage, and even the skin itself. And now we have one more cause: microclimate. Microclimate terminology may be a new term for most of us involved in pressure ulcer care. Research began in the 1970s, but was really overlooked until recently. Microclimate addresses skin temperature and humidity and its effect on pressure ulcer development. What do we know about skin temperature and humidity? How does this affect pressure ulcer development? How can we control and or manage these factors? The body of evidence on microclimate research is relatively small. What we do know is that the need for oxygen and energy increases by 10% for every 1 degree centigrade. As a result, changes to microclimate may alter tissue tolerance and make a pressure ulcer more or less likely to develop. Microclimate and all of its terms are yet to be fully defined and researched. This research may give us the answer to why all pressure ulcers are not preventable. Let's head over to the workbench and see what Dr. Jeff is up to.